how are the stimulant medications absorbed? Does it have to do with an individual's, I guess, with their height, weight, age, or their metabolism?
Yeah, we used to talk about dosing as per milligrams per kilogram, and that doesn't really apply. You'll find adults who are weighing 200 pounds will respond to, let's say, a very small dose of a psychostimulant, whereas in some children, they will require much higher dosages. So the response is generally unique to the individual. I think what we have to be careful about with some kids, particularly with motility disorders of the bowel, where they have like an irritable bowel syndrome or an adult, that they move the capsules through the system very, very quickly. The multi-coated layered capsules that we see with bifenton and Foquest, if you use medications that suppress acid production, then you can suppress the immediate release component of the medication. So that's something where we have to pay attention to, particularly in adults when they're on acid reducing medications. The other medication that we are a little concerned about with rapid motility through the bowel is Concerta, which is based on what we call the OROS technology. And if that's moved through too quickly, the medication is not absorbed appropriately. So what you have to do is really, address your treatments to the individual. And always start low and go slow. Even with the big adult, don't be fooled with body weight.
Right. Well, and then I guess that's another important thing to consider is once you've tried like one ADHD medication, you've tried one. There are the different classes, and you need to consider an individual's how they respond to it. So, if you're a parent or someone with ADHD and you've tried one medication, realize that it's just one medication, and trying a different medication will have a different result.
Yeah, I think one of the big things you have to be concerned about is the duration of action of these medications. For example, bifenton is an excellent drug that can be sprinkled in with small children, where 40% of the medication is released in the first 4 hours. And a lot of children, their greatest impairment is in the first 4 hours, the first half day of school, if you like. And so bifenton will address that. Whereas some of the other medications like Concerta, only 22% is released in the first 4 hours. And Foquest, which is the new kid on the block, only 18% is released in the first 4 hours. Ritalin SR, 50% is released in the first 4 hours. So you're constantly playing around with these drugs. And one of the things that you have to worry about is rebounding when these drugs stop working, because rebounding can be a real problem. And so sometimes what you end up having to do is to add another short-acting medication to your longer-acting medication to cover a longer period of time during the day, but sometimes to mitigate against rebounding. Sometimes we have to prescribe the longer-acting medications twice a day in order to get that duration of action that you look for. Ideally, we would like to have a medication where you use it just once a day and you get that waking period covered. For example, Vyvanse, which is an amphetamine-based medication, duration of action is about 14 hours theoretically, and Foquest 16 hours, which is methylphenidate. But again, you can have these medications only working for 8 to 10 hours in patients. So you really have to listen to your patient and titrate as per impairment and response.
Okay, so I think that one of the questions was, how can we help the kids who metabolize the meds so quickly, even if it's long lasting? And you're saying that doubling up.
Well, yeah, what you end up is increasing the dose, and you might want to just multi-dose during the day. I don't know as much that they're in fact rapid metabolizers, but they might be just poor absorbers of the medication. So they don't metabolize it quickly, but they absorb it poorly. And methylphenidate is more poorly absorbed than the amphetamine-based class. So yeah, it's you just have to sort of play around with it. And again, you start low and go slow.
Right. And then someone was wondering if vitamin C or ascorbic acid has an effect on the absorption of these medications.
I don't think so.